All right, so I'm going to get started. Hi, everyone, and thanks for joining me today as I talk about low back pain and pelvic girdle pain during pregnancy and beyond into the 4th trimester. My name is Rebekah. I'm a physical therapist with React Physical Therapy at our Lakeshore East Clinic, which is located right by Maggie Daly Park, kind of like Randolph, in like maybe 2 blocks off of Michigan, so right downtown. And then I have John Kim, who is joining as well. He's going to be a panelist to answer any questions that you may have throughout the presentation. And he's another PT within the company at our Deerfield Clinic in the northern suburbs. And then also on the webinar today is Ashley Honan, and she's our Director of Business Development. And she's also going to help me flag down if there's any questions that you guys have during the webinar that I may not see. Just a little bit of a background on React Physical Therapy if you have not been a patient with us before. We are a boutique-style outpatient clinic with 6 clinics around the city in the northern suburbs. At React, we focus on a whole body approach and stress one-on-one care with each of the patients. At the Lakeshore East Clinic specifically, we have a couple different specialties. We have vestibular therapy and women's health therapy, which I provide. And then with each of us having a little bit of a different background, we emphasize a collaborative approach. So if we feel that you may benefit from another therapist specialty or approach, then we help each other out and just to help improve your overall results. We are offering telehealth as well as in clinic services. If you're interested in services or ever want to refer someone to the clinic, we can usually get you in very quickly. And in Illinois, we do have direct access, which means that you do not need a prescription to start PT services prior to coming into the clinic. And then we do also offer complimentary injury screens. And then just a little bit more background on myself. I've been in an outpatient setting treating patients for about 5 years with a specialty of both orthopedic conditions, so just low back pain, shoulder pain, things like that. And then about 4 of those years, I've been specializing in women's health conditions as well. So conditions that are related to pregnancy, in the postpartum period, and then conditions throughout the lifespan of a woman too. The only condition I don't treat is lymphedema, which is a different specialization. So I'm going to go ahead and share my screen. I'm going to start my presentation here. So I wanted to give a little bit more background on what women's health therapy is. It's provided by a physical therapist or a physical therapist assistant. In PT school, we really only briefly learn about the pelvic floor. So pelvic floor therapists do go through additional and extensive training to learn and treat specific conditions that women or men may experience. There are 2 tracks that a pelvic health therapist can take. The first one is an OB track, or they can take a pelvic floor track. The OB courses don't teach any internal pelvic floor work. That is something that you learn specifically in the pelvic floor courses. Sorry, let me exit out of that little thing. So I've taken courses in both tracks. I do treat internally if it is indicated. It's not typical that a woman who is pregnant will have any internal pelvic floor work done, but sometimes it is indicated and performed as long as there is OB approval. Some of the conditions that pelvic health therapists will treat aside from pregnancy include diastasis, rectus, abdominis, any form of urinary incontinence, fecal incontinence, pelvic pain, endometriosis, constipation, and pelvic organ prolapse, just to name a few, because there's some more. And then pelvic floor therapists specialize in using internal techniques to assess the pelvic floor muscles and how they are functioning. So it's similar to when you go to like your OB-GYN and they do an internal exam. Pelvic floor therapists are trained to do that as well. So it's similar, except that we are assessing different things. We look at strength of the muscles, quality of the muscle contraction, muscle tone, so if the muscles are tight, and your ability to relax the muscles too. And then we use that information to add into your treatment to really emphasize what you're coming in for. And it's not just Kegels the entire time. It's really making sure your pelvic floor muscles are working with all the other surrounding muscles in the pelvis and your core to really make sure everything's working well together. At the Lakeshore East Clinic, we do have a private treatment room. So if you are coming in for any pelvic floor therapy specifically, we do everything in the private treatment room. So you're never out in the gym or anything like that. So it's pretty private. So just my agenda, I'm gonna go through the anatomy so that you know what I'm talking about. Changes during pregnancy, risk factors for low back and pelvic girdle pain. I'm going to get into a little bit with the diastasis rectus abdominis because that can affect low back pain and pelvic girdle pain, especially in the postpartum. And then what you can do to prevent pain or dysfunction. And then we'll get into some exercises as well. So with the anatomy, so we're looking at the lumbar spine over here, and this is a picture of the pelvic girdle and the lumbar spine. So the lumbar spine is made up of 5 vertebrae, and it has a slight curvature to it, which is referred to as lumbar lordosis. And then you have the pelvic girdle, which is made up of the pubic symphysis joint in the front here, and then the sacroiliac joints or the SI joints. So you have right back through here, you have it on both sides here. And then the lumbar spine connects to the sacrum through here, and then you have the coccyx as well. So the pelvic girdle is a structure that is important in withstanding forces from both your upper body and lower body. Because of this, it requires a lot of rigidity and stability. A lot of the rigidity comes from the shape of the joints in the pelvic girdle, but there are also a lot of ligaments that help create stability. So ligaments connect bone to bone and increase stability by preventing excessive movement of the joints. So you have the ligaments through here. You can see back through here, and then a ton that cross over this way. So the SI joint really doesn't like to move a lot. And that's because of the structure and the ligaments in that area. In addition to all of the ligaments, there are a lot of muscles that also cross the low back and the pelvic girdle. Any muscle imbalance in this area, so for instance, your abdominals, your glutes back here, your lats, those are big areas where you can have a muscle imbalance that can lead to pain or dysfunction. And muscle imbalance could be that the muscle is too tight. It could be that it's too lengthened or stretched. And then that can lead to other muscles compensating or being overused. So again, just leading to some pain in those areas. And then I'm going to touch on the pelvic floor a little bit because that's my area of specialty. So the pelvic floor muscles they start over here and then come up to this fascia through here, and then they wrap around through here and then come through here. So this is a hip muscle back through here, then another hip muscle. The pelvic floor muscles are considered to be the floor of the core. They are critical in supporting stability of the low back and pelvis, and often they become affected during pregnancy and during delivery and can enter into a state of dysfunction. If there is dysfunction in this group of muscles, then this can lead to low back or pelvic girdle pain, among other pathologies that we're not going to get into today. And some major kind of physiological changes that happen during pregnancy. So there are a lot of hormonal changes going on. One hormone in particular that I want to discuss is the hormone relaxin. It's an important hormone that causes connective tissues and ligaments to relax throughout the body. Normally the ligaments in this area that we don't see in this picture, but they're really tight because they try to restrict motion in the joints. So in someone who is not pregnant, the pelvic joints are very stable and don't move a lot. When the ligaments become relaxed during pregnancy, it allows for the joints to become more mobile in order to create space for the growth and delivery of your baby. However, sometimes this can be pathological and there can be too much movement or instability at the joint. So for example, the pubic symphysis joint, so that joint in the front here, the average separation of a non-pregnant pubic symphysis joint is anywhere between 1 to 5 millimeters. During pregnancy, there is an additional 0.5 millimeter to 7 millimeters. So it's a pretty large gap that you can see through here. You may not necessarily have pain from that, but if it's larger than, I believe, about 9 millimeters, so the separation through here, then that can lead to pain and dysfunction because there's just too much instability. So how can you counteract the inevitable ligament laxity during pregnancy? It's going to be relying on your muscles. It's really important to have strong muscles surrounding the pelvis and the spine to increase stability. That's why having a good strength routine before, during, and after pregnancy is really important in avoiding pain and dysfunction. Also of note, if you are breastfeeding, relaxin is still present. So your ligaments are still going to be a little bit more relaxed and your joints are going to be a little less stable. And some postural changes that happen during pregnancy. So you have rounded shoulders, usually due to the increased breast size. You have an increase in that lumbar curve, so an increase in that lumbar lordosis for a couple of reasons. One, the biggest one is the increased weight in the abdomen, obviously from the baby growing. And then with the ligament laxity, it kind of softens the ligaments in this area, and that can lead to an increased curve. And so a woman will usually try to counteract that, the weight in the abdomen and lean back more at the spine through here. You may also see an increased tilt in the pelvis. So through here, this part may come forward a little bit more. Again, just because of the increased weight in the abdomen. And then you may also see a possible rotation in the hips, especially like you may see someone who's waddling while they're pregnant. They're trying to create stability in the pelvis, so they just rotate their hips outward. These changes, though, don't necessarily equal pain and dysfunction. There are plenty of women who don't report any pain or dysfunction throughout their pregnancy, but they still have, these changes. But the postural changes can cause muscle imbalances to become worse, especially if they already previously existed. So some of the muscle changes that can happen, those muscle imbalances, you have the abdominals becoming lengthened in the front or kind of stretched. The pelvic floor muscles also become stretched. The hip flexors and the adductor muscles, the inner thigh muscles become tight. And then because of the positioning, often the glutes back through here turn off. And so you just have a loss of pelvic stability if that's happening in your muscles. And then what happens then when you have that muscle imbalance is that you rely more on those joints. And the joints are already loosey-goosey. So basically that can lead to muscle guarding, muscle spasms, an attempt to try to increase that joint stability. So we talked about how the ligaments become more relaxed and how this can cause pain if there's too much movement in the joints. That can cause reflexive muscle guarding and muscle spasms. We also talked about muscle imbalances that are a result of postural changes during pregnancy. And those muscle imbalances that occur during pregnancy can bring to light previous muscle imbalances that may have been there before pregnancy. Other risk factors for low back pain or pelvic girdle pain include a history of previous back pain or SI joint pain, history of trauma to the pelvis. So for example, if you had previously fallen on your tailbone or, fallen down the stairs, something like that, would be trauma to the pelvis. Pain in a prior pregnancy, and then asymmetrical activities or postures can be a risk factor for low back pain. So asymmetrical activities would include if you have other children, carrying children on one hip, large range lunges, fast walking, running, vacuuming, bicycling, stair stepping, so a lot of activities. And then asymmetrical postures would be, crossing your leg at the knee, like in the picture, pulling one leg up while sleeping, standing with one leg forward, positions like that. And, sitting for a long time if you're sitting at work can also be a risk factor. So what can you do? Obviously, you can't change the fact that you've had pain during a prior pregnancy or, that you fell on your tailbone while skiing when you were 10. But there are some simple things that you can modify during your pregnancy and after to decrease your risk of pain. The biggest one would be activity modifications, so avoiding asymmetric postures for an extended period of time and paying attention to your sitting posture while working. So maybe using a lumbar roll or a small pillow for your back. If you have other children that you're carrying, trying to avoid holding them on just one hip, or maybe consider using a carrier for them. And then using caution with asymmetric activities. If you're not already running, don't necessarily advise that. If you're pregnant and want to pick that up, I would probably choose a different activity to exercise. But if you are still running, try limiting how fast you run or taking shorter strides. If you're having pain with going up the stairs, try going up one step at a time, or maybe bringing both feet up to the step before going up to the next step. Or even limiting how much weight you're carrying up the stairs, like groceries, or if you're carrying other children up the stairs too. If they can walk up the stairs, have them walk up the stairs. And then using and being aware of proper lifting mechanics. So again, if you're lifting other children, maybe try having them climb up onto a higher surface so that you don't have to bend forward as much. Or, maybe at that point you try to minimize how often you're lifting them. You want to try using squatting as a way to lift instead of bending at your back. And then avoiding heavy lifting as much as you can. Try to get someone else to move whatever you need, especially during pregnancy, maybe not as much in the postpartum period. But exercise is another thing that you can really focus on, making sure your glutes, your core, your lats are all strong. Because remember, we talked about relying more on your muscles to make your joints more stable, since your joints are just going to be looser throughout your pregnancy and into some of your postpartum period. We're going to go over a few exercises in a few minutes to both have some pain relief if you are experiencing pain, and then a couple of strengthening exercises to add into your routine. And then physical therapy. You've tried to modify your activity, you've tried to stretch and just different things to help reduce your pain, but you're still experiencing pain. I highly recommend PT because you do really want to enjoy your pregnancy as much as you can. You want to enjoy your time with your baby and avoid having pain in the future as well. So diastasis rectus abdominis is a very common condition that women may develop during pregnancy and will notice in the postpartum period. Obviously, during pregnancy, your belly gets bigger. This causes the linea alba, which is connective tissue that attaches both sides of the rectus abdominis muscles through here. Basically, with your belly growing, it expands and stretches that tissue. It can become so stretched that it causes a separation of your abdominal muscles, which you'll see through here. And then this can lead to low back or pelvic girdle pain, even urinary incontinence too, and other like pelvic floor dysfunctions. Your biggest risk factors for diastasis rectus abdominis: multiparity, so you have twins, triplets, significant weight gain during your pregnancy, or even obesity can cause a diastasis, so that separation, high birth weight of the baby, older maternal age, and then multiple pregnancies, just as that connective tissue through here continues to stretch with multiple pregnancies. So what can you do to prevent the diastasis rectus abdominis during pregnancy and in the postpartum period? You want to try avoiding sit-up exercises. So avoiding, like a jackknife sit-up. So if you're laying down, when you're getting up from the bed, you don't want to just sit straight up. You want to maybe roll to your side to help prevent that from happening. If you're going to do any bending, lifting, pushing, or pulling activities, try to exhale during those activities, which will help to engage your core a little bit more and really just help prevent that separation. And then avoiding aggressive stretching. So like if you're into yoga, this probably is not something that you're doing during pregnancy, but in the postpartum period, trying to avoid doing a cobra position, just because that's going to be a pretty aggressive stretch on your abdominal muscles. You can do some exercise during pregnancy to help reduce the risk of separation or prevent it from getting larger. But you are going against an expanding belly. So, and we'll go over a technique that you can use. Typically, you'll notice the separation right after delivery. Within 6 weeks or so, that separation really should improve. If it doesn't by then, it's something that you're going to want to address through physical therapy because it's most likely not going to resolve past that point on your own without specific exercises. And then after pregnancy, you may consider using an abdominal binder, which will just help bring those muscles together, your abdominal muscles together as those muscles are healing. It just kind of makes it a little bit easier for those muscles to heal. Okay, so I'm gonna exit out of the presentation. And I'm gonna stop sharing here. And I'm gonna get into some exercise demonstrations. So the first 3 exercises that I'm gonna demonstrate are to help with pain relief. With any of the exercises, if they make pain worse, you maybe try modifying it if you can. If it doesn't seem to make it better or your pain gets worse after the exercise, then you want to probably reach out to a professional. So PT, again, would be probably good. So the one, let's see, let me bring this down a little bit. The first one is going to be a cat-cow. So you can modify this, but we're going to start on the ground in this position. So what you're going to do, you're going to try to round your back up. You're tucking your tailbone under, and as you do that, you're going to tuck your chin towards your chest. And then you're going to alternate, and you're going to stick your butt up in the air and look up. And you're just going to repeat that. If you have pain getting down to the ground, you can modify this by leaning over over a countertop or your bed, for example. So if I were standing, then it's going to look more like this. So here to here. Right. And I would recommend, trying that 20 times or so. It may feel a little painful to start, but as you do the exercise, it should improve. I would use caution, like if the pain gets worse as you're doing the exercise, then stop. If pain doesn't really change during the exercise, you can continue to do it and reassess how you feel after doing the exercise. The next one is using a Swiss ball. I'm going to bring this up a little bit. So with this, I'm going to sit on the ball, and I'm going to make circles on the ball. So I'm going to start off clockwise, doing circles, right? And then I'm going to just go counterclockwise. And this helps just to basically take some stress off the spine in both directions. And it should just feel pretty good. It shouldn't cause any pain or discomfort. The key with this one is making sure you're not moving your whole entire body. It's moving just the hip, the pelvis, going around in circles. Okay. So again, maybe 20 to 30 times in each direction. You can do a little tilt, so you can go forward and backward. And you can even go side to side, like this. Okay. And the last kind of pain relief one I'm going to show is using a lacrosse ball. So this is a rubbery ball. It's pretty firm. You can always try it with like a tennis ball. It may not be hard enough. So we're going to use this on your glute. So if you take the ball here, and you're going to bring it onto the glute back through here. So I'm going to put my weight onto it, and then with that leg on the same side, I'm going to flutter up and down. The key with this one, so the biggest thing to look out for, this is a direct muscle release. This can take away some stability. So if you have any muscle spasms, it can take away some of that stability that your muscles are trying to give. I would use caution with this one, but I would do like a strengthening exercise right after to make sure that you add that stability back to that joint. And you can find a different spot on that glute. And I would say like about a minute or two. You can do it on the painful side. You can also do it on the other side as well. Okay. This next exercise it's a little bit hard to fully show, but the explanation will hopefully help. So this one you can do to help prevent the diastasis rectus during pregnancy. You can also do this in the postpartum period too. I'm sitting here on a ball. You can do this on the couch as well, or just a regular chair. What I'm going to do is I'm going to pull my low abdominal muscles in towards my spine without holding my breath or without flattening my back. So my back stays just in a neutral position. I'm going to try to pull my belly in towards my spine. And I'm just going to hold that for about 10 seconds. So if you think about, if you're pregnant, giving your baby a hug. Okay, and you're just going to tense the muscles through here. I would recommend starting, a 10-second hold and maybe 10 times. So if you are pregnant, you can also, if my stomach was pregnant. If I bring my hands onto my belly and I push the muscles together and then pull in, it's just going to help kind of bring those muscles, those abdominal muscles, towards the midline to help prevent that from separating. And there's different techniques in the postpartum period to help bring those muscles together. That's not something we're going to get into today, but for prevention-wise, you can bring your hands through here. Okay. The next exercise, this is a good glute exercise. It's going to be bridges. In pregnancy, you do want to try to have your shoulders elevated, so higher than your hips. So you can do this at the edge of your couch. I'm just going to bring the base of my shoulder blades onto the bench here. I'm going to bring my legs out. I can hold on here if I need to, otherwise I can rest my hands here. And then I'm just going to sit down a little bit, and I'm going to lift using my glutes so that my hips are parallel to the ground. And come here, and then up. And then hold at the top for about 3 seconds, and then lower down. Okay. That one should not cause any pain in the back. You shouldn't feel that in your back. So if you are, then you may need to bring your feet in a little bit closer towards you, or you can always try squeezing a ball in between your knees. So squeeze a ball or squeeze a pillow in between your knees. So that was a good one to do after the releases, that glute release. Otherwise, I'm going to show you how to do some clamshells, which will also be a good one to do right after that glute release. So I'm going to use the band. I'm going to put it around my knees. I'm going to lay on my side. I'm going to pop my neck up a little bit with my hands. My knees are going to be bent, and my hips are going to be slightly bent. I'm keeping my feet together, and I'm going to just lift my top knee up and then down. So when I'm doing this, I should feel this in that top glute. I shouldn't feel anything in my inner thigh. Okay? If you're not feeling that top glute, bring your knees back so that my hips are straight here instead of here. So I bring them back through here, and then I'm going to lift, same thing. If you're still feeling it, and you're not feeling it through here, you're maybe feeling your inner thighs work, try modifying the amount of resistance. You can try it without resistance to start and see how it feels, and then, maybe go with a lighter band if you have a lighter band. If you don't have any resistance, that's okay. You can still do the exercise, and it'll still be helpful, because you're just going to try to really engage those glutes. And I'm going to do this between 2 to 3 sets of 10, depends on how quickly you fatigue. If you start to feel other muscles engage, maybe you've tried 20, you're going to go for 30, and you start to feel other muscles engage, then you probably want to stop at that point or take a break, because those muscles are probably just fatiguing. I do want to say, I have a little quick blurb about doing Kegels, because I know a lot of women will have that recommendation made to them to do Kegels during pregnancy and after. I usually don't necessarily recommend doing Kegels until I actually evaluate the pelvic floor. The thing is that we don't really know if your muscles are tight. If you're trying to strengthen a tight muscle, then it's not going to be effective. Especially in the postpartum period, sometimes after delivery, especially a vaginal delivery, those muscles can, you went through some trauma, especially if you tore, those muscles can spasm, they can tighten up, and so doing Kegels is not going to be effective. It's not bad to do them. You can definitely try them and see if it helps to reduce your pain or dysfunction, or maybe you're experiencing urinary incontinence, which we're not really talking about today, but worst case scenario, it's just not going to help. So you can always try them, but I don't usually recommend them without evaluating the pelvic floor. Okay, so I'm going to go back to sharing my screen. So that's pretty much it for my presentation. I just wanted to say thanks for participating today. I really think that the more you understand your own anatomy and changes that happen during pregnancy, you really can be more in control of what happens during your pregnancy and your postpartum experience. Just going to give my little plug for PT. During pregnancy, PT can really help to reduce pain, can work on improving strength, and it really gives you the time that you may not have with your OB. Really gives you that time to ask questions with a health professional. And during PT in the postpartum period can really help speed up your recovery from both pregnancy and childbirth. You went through so many changes in a really quick 9 months, and then, delivery, whether you had a C-section or you delivered vaginally, is trauma to the body. It's good trauma, but you really want to take the time to make sure you recover well, especially while your muscles are still healing. So I'm going to take this as an opportunity to now see if there are any questions that you may have. And here's my contact information. I am always available via email or phone call. If you don't have any questions right now, be more than happy to answer any questions that you may have in the future, either about pregnancy, postpartum, any other conditions as well. I'm going to go ahead and exit out of this screen just so I can see the chat. You're welcome, Diane. Any questions? Wait a few more minutes. You're welcome from Costa Rica. All right, I'm just going to wait maybe another 30 seconds to see if you have any questions. Otherwise, feel free to reach out. Again, I'm at the Lakeshore East Clinic, so you can always give the Lakeshore East Clinic a phone call if you don't have my contact information or don't remember it. If you have other questions. All right. Well, thank you again. Hope everyone stays cool, and hopefully we have a nice 4th of July coming up. All right. Bye, everyone.